Welcome to this live telephone town hall. We're dialing out to thousands of homes in the area. And on this telephone town hall tonight, we're going to be answering your questions live, and we'll also give you a chance to be a part of interactive survey questions. Most importantly, we will be discussing the COVID-19 pandemic. Our speakers are going to be joining us in just a moment, but I want to tell you how you can participate in tonight's telephone town hall meeting. You can press 0 at any time if you have a question, press 0 if you have a question, and you will be placed in a queue, and our operators will then assist you in asking your question. Our speakers are going to answer as many questions as they possibly can tonight, time permitting. If you do have a question but you don't want to go live, you can just let your operator know, and we can read the question for you, whatever's most comfortable for you. Again, if you've just joined us, we've had some new folks join us. I'm going to repeat myself and welcome you all to this live telephone town hall. We're dialing out to thousands of homes in your area. On the telephone town hall, we're going to be answering your questions live and also give you a chance to be a part of interactive survey questions. Most importantly, we're going to be discussing the COVID-19 pandemic. Our speakers will be joining us in just a moment, so please hold on. I want to tell you very quickly how you can participate in the telephone town hall meeting. If you have a question, simply press 0 on your keypad, press 0, and you'll be placed in a queue, and our operators will then assist you in asking your questions. We're going to get to as many questions as we can tonight, time permitting. With that, I would like to turn the call over to Michigan State Director for the State Innovation Exchange, Tom Leonard. Tom, take it away.
Thank you so much, and thank you everyone for joining the State Innovation Exchange's Tele-Townhall for a conversation about work being done to protect our community's health, our economy, and our democracy during the COVID-19 crisis. My name is Tom Leonard, and I'm the Michigan Director for the State Innovation Exchange, and I'd like to introduce our state lawmaker panelists, and then we'll get right into your questions. We also have Kathy Forzley, Director of the Oakland County Health and Human Services Department, and Jennifer Llewellyn, who's the Manager of the Oakland County Workforce Development and Director of the Oakland County Michigan Works Agency, who'll be available to answer your questions. So first, we're going to start by saying hello to Senator Rosemary Bayer. Senator,
thanks, Tom, and thank you, Tom, and thanks everyone for joining us today. I am your state senator from District 12, which covers Lake Orion, Oxford, Clarkston, Leonard, Auburn Hills, Pontiac, Keego Harbor, Sylvan Lake, Beverly Hills, Bingham Farms, Franklin, and the townships of Bloomfield, Southfield, Oakland, Addison, and Independence Township. I'm delighted to be with you. Thanks.
Thank you so much. We're really glad you could join. And now we have Representative Padma Kuppa to say hello as well.
Good afternoon, everyone. Thank you so much for organizing this, Tom. It's really good to be here with you and with everyone from SIX, as well as with my colleagues, Senator Bayer, Representative Carter, and our wonderful governor. I represent Michigan House District 41, which is the two cities of Troy and Clawson, and I'm glad to be here.
Thanks, Representative. And now we also have Representative Brenda Carter.
Yes, thank you for having me. Thank you for putting this on. I am Representative Brenda Carter from the 29th District that represents the communities of Auburn Hills, Keego Harbor, Sylvan Lake, Orchard Lake Village, and of course Pontiac. I am so glad to be here and glad everyone could join us.
Thank you so much, Representative. And now I'm very excited to introduce our governor, Governor Gretchen Whitmer, who will share all the work that she's been doing, give us an update and some key priorities that she'd like us to keep in mind. So I know she doesn't have a ton of time tonight, but wanted to share her thoughts with us. So thank you, Governor, for joining us.
Yeah, happy to be here with all of you, and thanks for organizing this. I think right now more than ever it's important that we're able to share accurate information and talk through kind of this unique crisis that we are confronting as a state and as a nation and as a globe, frankly. As of today, our case counts are up to 7,615 confirmed cases, 259 deaths, and we know that the trajectory is still trending upward and climbing exponentially, and that's precisely why we've thought it was important to take really aggressive actions to protect people. So in the past 3 weeks, I've issued a number of orders. The first, or not the first, but I think the most sweeping was the Stay Home, Stay Safe executive order, which orders all non-critical businesses to temporarily suspend in-person operations and direct all residents to stay home unless it's for essential work or needs. I've signed 2 supplemental budgets that commit $150 million to combat COVID-19, which is absolutely critical because we know we don't have enough of the N95 masks and gowns and ventilators and hand sanitizer that we need to combat COVID-19. And we're working incredibly hard with the feds. We're working outside of the feds to procure these things. And we're working with great Michigan businesses that are stepping up and starting to produce some of these things here. But as of this moment, we do not have enough, and we've got to continue working on all of those fronts. I also extended the April 2020 state and income tax filing deadlines to July, as the president did on the federal level. And we also expanded unemployment benefits to workers who have been impacted by COVID-19. We've taken a lot of other actions to protect people from foreclosure and eviction and many other orders, but these were some that I wanted to highlight for this call. You know, over the weekend, MDHHS launched a new volunteer website. It's www.michigan.gov/fightcovid19, where we're encouraging trained medical professionals to register to serve their fellow Michiganders by assisting hospitals in fighting COVID-19. We are also urging state residents to use the site to find out how they can help in their local communities, whether it's by signing up to donate blood or if there are other financial resources or other needed medical supplies people might have. I've talked to Michigan businesses who found a bunch of N95 masks in a warehouse. You know, anything can make a difference. We really are getting through this by all banding together and playing our part. And if your part consists of finding some masks in a warehouse or just simply staying home so that we combat the spread, each of those is important, and I thank you for doing your part. We've also called on Michiganders and businesses to donate items or to start fabricating some things. So we've got distilleries in Michigan that are now producing hand sanitizer. We've got auto companies that are transitioning into producing face shields and face masks and ventilators. And so anyone who is looking to make some sort of a donation can go to the Michigan Community Service Commission or and just log on through COVID-19 donations at michigan.gov. The coming days are going to be unlike any challenge we've had before. It's going to require that everyone does their part. It's going to require fortitude and strength and grace. You know, our frontline care providers are superheroes, are people who are stocking our shelves. If you can say thank you on that rare trip you make to the grocery store. Our sick will need beds and care. Our unemployed will need some assistance. Our businesses will need information. But what I know is that even on the hardest days, and there have been some hard days and there are some ahead, there's inspiration in my fellow Michiganders. There's strong and smart, determined people who are showing up and doing their part. So no matter who you are, where you come from, how you identify, no matter your age or your risk factors, your race or socioeconomic status, your safety and your health matters. And we're going to keep fighting for you. So when I say we're going to get through this together, I mean it. And I look forward to answering some of your questions.
Thank you very much, Governor. We appreciate that. And thank you to everyone who's joined. If you've joined us just in the last few minutes, I want to welcome you to this live telephone town hall where we have several speakers, including Governor Gretchen Whitmer, who's giving us an update on COVID-19. If you have a question for our panel today, please press 0 on your keypad. Press 0 at any time on your keypad. We will take our first question from Lisa in Clawson. Lisa, go ahead with your question, please.
Did you say Lisa?
Sure did. Go ahead, please.
Oh, okay. Yeah, my question is, and I know Representative Kuppa is familiar with my issue, and my husband, he's a musician, and since COVID-19 came about, he's lost all of his performance gigs. I mean, his income was decimated, right away. And he does also teach private piano lessons, and he has been able to retain those clients, teaching them online. So he's not unemployed, but he has that income, but his performance was a large part of his income, so he's underemployed. So my question is, does he qualify to claim unemployment? but I didn't see anything on the website as of yet.
Thank you very much. Governor Whitmer, go ahead.
Yeah, so yes, is my understanding that he does. I know that our unemployment system has been completely overwhelmed because there's so many people who are out of work and seeking some help from the state. So I would encourage him to go online and to file. You might need to give it a day or two because I know that they're trying to revamp it so it can handle the incredible load that's been put on it. But I do believe that he will qualify for some assistance, and we have waived a lot of the prior requirements that for applicants, because we know getting documentation from an employer is in this circumstance just not really realistic, and so we have made it easier for people to get some assistance. But I would encourage him to pursue going online and doing that. And if Representative Kuppa knows, we can help as well if he's still struggling.
Thank you. And we also have Jennifer Llewellyn from Oakland County, Michigan Works. Jennifer, can you weigh in on that, please?
Absolutely. Thank you, Lisa. That's a great question and a common question we're receiving from individuals who are self-employed, gig workers, or independent contractors. I would encourage you to follow the michigan.gov/UIA website for more information. They posted some information today encouraging self-employed workers, gig workers, and independent contractors to not apply at this time. The applications will be open in the next few days. If he's already applied for unemployment benefits, he does not need to reapply.
Thank you very much. Our next question comes from Cindy. Cindy, go ahead with your question and tell us where you're calling from, please.
Hi, I'm calling from Lake Orion, and thank you for everything you're doing to try to help during this time for the people of the state of Michigan. We appreciate that. My question is, I've got some friends who are truck drivers, and certain states around us are now finding that they're closing all of the rest areas. And as you know, these truckers have mandatory rest times that they have to stop for. And with a lot of the restaurants and other businesses closing, they're finding it harder and harder to find places to do that, as well as to find bathrooms, to use the bathrooms. And if we are closing our rest stops, these truckers who need these things, they're going to have a lot of hard time. And I just want to make their job easier. Can we keep our rest areas open for them with this in mind?
Thank you for raising that. I am going to fire off an email right now to see where we are at. I think you're making a really important point. We have lifted some of the weight restrictions on our road so we can get materials in, especially, groceries and those kinds of goods that are essential. And you're making a really important point, one that no one had made to me as of yet. And so I am going to look into it and make sure that we have made allowances for this, because I think I'm grateful that you raised it.
Thank you very much, Governor Whitmer. We know you're very busy, and we appreciate your time, and we know you've got to get going, so we'll let you take off if you have any final words.
I simply would just say this. I appreciate everyone calling in, trying to stay informed, make good decisions about yourself and for your families. This is a time unlike any we've been through before. We will get through it together, but everyone doing their part is really essential, and staying home as much as you possibly can, limiting even trips to the grocery store to one a week or less if you can get away with it. It's the best tool we have to fight this virus, keeping our distance so it can't continue to spread. So thank you for doing your part.
Thank you very much, Governor. We will continue on with the call. We have Senator Bayer, Representative Kuppa, Representative Carter, and many others on the line here who are here to answer your questions. If at any point you do have a question, please press 0 on your keypad. Press 0, and we will get your question answered. We'd like to start out by mentioning a few key health recommendations and questions around those. Then we'll be discussing some economic issues like health for workers, small businesses, and ways to protect consumers from scams and price gouging. We're going to take our first call from Sandra. Or our next call rather. Sandra, go ahead, please.
Yes, I just wanted to know if they could get some type of person that has an idea about nutrition to explain to people what they could do nutritionally to keep their immune system strong throughout this crisis.
Thank you very much. Kathy from Health and Human Services in Oakland County, can you answer that, please?
Yes, I'd be happy to. So we keep trying to reinforce that taking care of yourself during this period is absolutely essential, and I agree with you. We need to all be working on our immune systems. We try to make sure everyone realizes that sleep is a very important component to staying strong and healthy. Our bodies repair ourselves at night, and so good sound sleep is very, very important. Also, sound nutrition, as you say, is very important. Fruits and vegetables are also very important, and just making sure you're eating properly. Sometimes when we are at home, we're attempting to snack. There's a lot on the media about, the self-isolation snacking that's going on, but we're really trying to reinforce that everyone should really keep working on that sound diet with lots of fruits and vegetables, and also get outside when you can and get some fresh air and sunshine. As long as you're social distancing, there's nothing wrong with that. Also a very important component for both your physical and mental health during this time.
Thank you very much. We have with us State Senator Rosemary Bayer. I wonder if you would give a few remarks, followed by Representative Padma Kuppa, and then finally Representative Brenda Carter. If you please give us some remarks and tell us what's going on from your vantage point, please.
Sure. This is Senator Bayer. I'll start off. I was going to talk a little bit about some of the safety things that we're talking about seeing and just some general advice on that. The first thing I want to say is we're all online right now, but we have to be really careful to not listen to rumors, to pay attention to sources like our experts who are here today, like the CDC, the state of Michigan, the Oakland County sites, where you can really trust the message. There's an awful lot on social media that's not particularly helpful. So for safety, we know there's no vaccine yet for COVID-19, and so our real focus is on not getting it, and of course that's why we're staying home. And when we can't, we keep 6-foot distance from other people. If you are closer than that, you can inhale the droplets from somebody else's cough or sneeze, and that's the most likely way of catching it. So you can also catch the virus by touching something that has the virus on it that was touched, and to remember that it lives on cardboard for up to 24 hours and on steel, plastic, and paper for up to 3 days. So I have my mail airing out in the garage for a few days. I figure I can wait a few days before I worry about my Bed Bath & Beyond coupons. Your mail, you just have to pay attention. Try to open packages outside. When you bring groceries in, try to disinfect the outside of the containers before you bring them in the house if possible, but carefully do that and wash your hands. Wash vegetables when you unpack groceries. Well, inevitably you're touching things, and so the new habit that we're all trying to build is not to touch our face, which is really tough. We're trying to fix our hair and all that, so don't do that. It's work, but it's worth it. Wash your hands often, at least 20 seconds with soap and water, and use sanitizer only if you can't get soap and water. Soap and water actually works better. And sanitize the things that you touch frequently around you, the doorknobs, light switches, tables, phone, keyboard, desks, your toilet, your faucet, your sink, all those things. And I kind of fanatically put things away in my house, but I actually leave those bottles of sanitizer out and available, so I remember to do that a lot. Just little tips as you go forward, things that will help you. Thanks. And I think we go over to Representative Kuppa next.
Thanks, Senator Bayer. Is really, I can't repeat enough how many times I've heard wash your hands as being the #1 thing to do to avoid getting the virus. Another thing that I think that we need to think about is I was on a call with someone from the World Health Organization. We were in session on the 17th, and shortly after that, we ended up moving everything into online and telecommuting kind of options. And one of the resources that I had was to get information from different organizations, from the county, from the governor, from our caucus. And in this particular call, they said also, don't get overwhelmed. Don't panic, even though this is a pandemic. We are working on solutions. We are trying to help people and to manage your stress. So whatever it is that you do personally to help manage your stress levels, because that also helps boost your immune system, and getting a good night's rest is really, you have to be calm to be able to sleep well. And so to make sure that you are on top of stress management, whether it's taking a walk in the woods or taking a yoga class online, finding a yoga video on YouTube, maybe meditation is your thing, but definitely one of these things will, whatever it is that you like to do to manage your stress, I think that's also a very important factor during these times. And then we've been getting a lot of calls from people who are very concerned about their small business, about their unemployment, as constituent Lisa called earlier and asked. And we've been guiding people to the correct resources, trying to help them navigate both the federal and the state resources that are available. We've actually created a folder online that people can access to get information. We've recommended that people sign up for our bi-weekly updates. They've actually been more frequent. We send out e-news. We also have put a lot of information out on social media, trying to give people accurate information. And I think that's another thing that Senator Bayer said that's really important, is to be cognizant that not everything that's out there is 100% accurate. Please go to the correct sources and make sure you verify the validity of the information that you're getting. And I'd like to turn it over now to my colleague, Brenda Carter.
Yes, thank you, Padma. And that was a very good point of making sure in this time that we are aware of all the scams that are out there. A person was caught selling toilet paper, a case of toilet paper for $60. Another case is where they're selling the protective mask for $80, 10 of them, where they usually sell for $1. Scammers may call you pretending to be medical personnel who claim a relative is sick and in the hospital and need medical assistance. They may even make the call appear to be like it's coming from a legitimate source. Consumers may get email notices asking them to click on an attachment in order to get a COVID-19 test. A lot of times this ends up being malware. It's a virus, and once it gets into your computer or your device, it will steal your information. Businesses could be in violation of the Michigan Consumer Protection Agency if they are advertising or representing goods or services with the intent not to dispose of those goods and services at the advertised price. Charging the consumer a price that is grossly excessive of what the price is. Causing coercion or duress as a result of the time and nature of sales presentation. If you are in this particular, or you witness gouging, consumers can file a complaint online by calling the Consumer Protection Tip Line at 877-765-8388. That's 877-765-8388. The hours of operation are between 8:30 a.m. and 4:30 p.m. Monday through Friday.
Thank you. Our next question comes from Amy. Amy has a question about her small business. Go ahead, Amy, with your question, and please tell us where you're from.
Hi there. My name is Amy, and I am from Lake Orion. First of all, I just want to thank you so much for everything that you're doing for the people in the state of Michigan. So appreciated, and I appreciate the dialogue that we're able to have here today. I have poured my heart and soul and all of my life savings into my business, which was to open in downtown Lake Orion in April. I am wondering, I know there are so many people in my position across the state of Michigan that were in the process of opening their small businesses. At this point, since the shutdown, I don't have an income. And I don't know what benefits I would even qualify for since I don't have 2 years' worth of tax returns. I can't show any revenue. So I just have all of this debt hanging in the wind, and everything I own is poured into this business that was to open in April. I provide microblading services, spa, and a salon. So we were shut down pretty quickly before I even had an opportunity to even have the health department come in and license the building. So now I am just at a complete standstill. I don't know when my business will open. What are options for those of us that are in this position with businesses that are shuttered before they even had an opportunity to create revenue?
Thanks for that question, Amy. We've got a whole panel here who's got some responses for you. First, we'll go with Senator Rosemary Bayer. Please go ahead.
Hi, thanks, Amy. Thank you for calling in. You are in a difficult spot when you don't have any history. It's going to be tough for you, but what you can do is on our website, on the senatorbayer.com website, there are links to the SBDC, our Michigan Small Business Group, to kind of go through the opportunities there. You will probably have to apply for a loan, and I don't know how you feel about that, given that you've already spent money trying to get your business open, but it's something that's going to help you span the gap. Might be the right way to do it, to get a business-backed or a government-backed business loan. And I know that also on the phone we have Jennifer Llewellyn from the Michigan Works, and I think she has some other thoughts as well. Jennifer, are you there?
Yes, good afternoon, and thank you, Amy, for your question. I know you're in a tough spot, but we have a great team that will do our best to help you. I would suggest two options. First, checking out the Oakland County Stabilization Fund that was established as part of the Michigan Small Business Relief Program. There is a loan option and a grant option. Without the documentation, it might be a little difficult, but I would encourage you at least to check it out, and that can be found at the Oakland County website at oakgov.com/COVID, COVID, and it gives you information on both the loan and the grant. And the second option is unemployment benefits have been expanded to individuals who are gig workers or self-employed or entrepreneurs. And so I would encourage you later this week, when that application is made available on the State of Michigan website, to at least apply for those benefits. And whatever documentation you do have around your investments in the business and the money that you've spent on the business, I would encourage you to gather that information. I'm not certain exactly what type of documentation the Unemployment Insurance Agency will be asking for, but I would encourage you to get that information together and to file a claim later this week.
Thank you very much. Folks, if you have a question for tonight's panel, please press 0 on your keypad. Press 0 on your keypad if you have a question. We will take Speranza next with your question. Go ahead, please.
Hello, my name is Speranza, and I'm calling from Troy. And I was wondering if our legislators have considered approaching the utility companies to ask them to waive charges during this crisis for those families who have lost their jobs.
And Representative Kuppa, can you please answer that?
Rhonda, it's very nice to hear from you. I do want to say the governor is taking on a lot of different executive powers, and one of the things that she did was to restore water to occupied residences during the COVID pandemic. And so she's restoring water because it's a critical public need. I do not know that we have any executive order or any legislative effort going on about asking the utility companies to waive fees during the crisis, but I would consistently check back to the Michigan.gov coronavirus website to see if anything has been done or if there's any new information. The other thing is that if people do have concerns, they can either email the COVID-19 hotline at 888-535-6136 or email covid19@michigan.gov, and that's 24/7, and people are answering those emails 7 days a week, 8 a.m. to 5 p.m. But it is something that we can look at to do either legislatively or through a executive order. And so, but water is the most basic one, and that is one that has been addressed through executive order number 28.
Thank you very much. Senator Bayer, you had a thought on another scam that's popped up. Can you share that with us, please?
Thank you. Yeah, it's a new one, and it's so topical and relevant. I wanted to make sure folks heard about it. This is related to the $1,200 that folks are going to be getting, many people will get through the federal government stimulus. And already there are emails coming from websites that will look official, and they're asking for PayPal information or bank account information that you need to put in order to get your $1,200. And none of them are correct. None of them are real. They're all scams. So don't believe anything that comes at you in an email like that. Don't type your numbers in.
Thank you. Good warning. We appreciate that. Folks, we have our first polling question coming up, and we would like you to vote on your touch tone pad. What is your biggest concern right now? Press 1 if it's for personal or family health and safety. Press 2 if it's access to food. Press 3 if it's paid sick leave or job loss. Press 4 if it's losing a small business. And press 5, please press for something else. I'll read the question again. What is your biggest concern right now? 1 for personal or family health and safety. Press 2 for access to food. Press 3 for paid sick leave or job loss. Press 4 for losing your small business. And 5 for something else. We appreciate your votes and appreciate you taking part in this. Please continue to vote. We will go to our next question. This is a question that I'll read. This came in from Vernon in Pontiac. And he says, I have a loved one in jail. What is being done to protect the people in jails, and how can I reach the unemployment office over the phone? I can't get through. Representative Brenda Carter, can you take that question, please?
Yes, and thank you for that question. The governor has just recently put out an executive order to mitigate some of our incarcerated, not only in our local jails, but in our juvenile facilities as well. Padma, do you have additional information on the executive order? I'm not at my computer, but I know that the governor has taken this on and she's serious.
Yes, thank you, Brenda. It's executive order number 29, and it is temporary COVID-19 protocols for entry into MDOC facilities. So all the corrections facilities, transfers to and from department custody, temporarily recommended COVID-19 protocols, and enhanced early release authorization for county jails, local lockups, and juvenile detention centers. I think that's a really important one, so that we are releasing nonviolent people who are incarcerated to mitigate the spread of COVID-19, to protect the public health, and provide essential protections to vulnerable Michiganders who work at or are incarcerated in prisons, county jails, jail lockups, and juvenile detention centers across the state. They're implementing these temporary COVID-19 related protocols. And so I think, like I said, as every issue comes up, people are looking at this. The governor has staff. In fact, the Attorney General staff is also working with her because they are the law enforcement. As a caucus, we actually had a call with the Attorney General to seek clarification on some of these things, because one thing I've learned as an engineer that law can sometimes be not 100% clear until you need clarification, and we found that there have been clarifications issued on a number of things, like what's a critical infrastructure worker, and how does a critical infrastructure worker get child care, for example. And so other executive orders have been issued around all of these topics. But I do want to just mention one really important thing, and that is that we really need to have paid sick leave. And this is one of the things that a lot of workers across our state had actually asked for, and we are not seeing that because in 2018 that legislation was adopted and amended by the legislature. And so I introduced a bill in early March actually to restore the Michigan Paid Medical Leave Act so that people could get medical leave. I think this is really important at a time like this. We see now more than ever the need for people to be able to stay home instead of going to work. But when they have to make a choice between going to work or staying home, you know, paying the bills, they're more likely to go to work instead of staying home. So there's a lot of things that we are addressing through our offices, and so please, if you don't have a question answered, we're not able to get to your question, please leave us a message and we will get back to you.
Padma, I want to add in onto that if I can, because the caller was from Pontiac. We have a very active group in Pontiac, currently chaired by Deborah Slater Black, where we work with people in our community to help with recidivism rates, as well as to help our incarcerated get earlier releases from the detention centers. So if anyone from Pontiac or District 29 is interested, if you have a loved one that you're concerned with, please reach out to my office at area code 517-373-0475, and we'll get back with you to help you resolve your issue.
Thank you. Kathy, the Director of Health and Human Services for Oakland County, would you also like to respond to that?
In terms of protecting people in jail, is that the question?
Yes.
Yeah. So one of the things that has happened on top of the governor's order is for only essential services to be working, we have added on to that an order from the health officer which requires screening for workers that are coming into, or even visitors that are coming into places where there are essential services. So that means that any worker that is coming into a jail, whether it be, for instance, if we're talking about the county jail, if it's a deputy coming in for their work shift, or if it is the medical personnel coming in to staff the clinic, or if it's the food service contractors that are coming in to do the food service, they're all required to go through a screening process to assess their health at the beginning of every shift. And we all know that, you know, we want to keep COVID out of these facilities because the transmission in these close quarters could be devastating to the population. So anyone new coming in, if it's a new inmate or a worker, is going to be screened to make sure that they're healthy. In the case of an inmate that has to be in there and they're new to the facility, if it is found that they have any signs or symptoms of COVID, they would be put into isolation rooms to watch and see if this illness progresses, secure testing for them should that become necessary, and really make sure we're protecting all of the other inmates in the facility.
Thank you. And then Jennifer Llewellyn, Department of Workforce Services and Oakland County, Michigan Works. Do you have a response on the unemployment portion of that?
Yes, as you might imagine, the unemployment agency is experiencing a significant increase in their call volume. For example, one day last week, they had 1.7 million telephone calls to the 1-866 number for individuals to call. So I know that it can be very difficult for individuals to get through right now. We encourage you to be patient, to try, very early in the morning or maybe later in the day during non-peak times. In addition, the Unemployment Insurance Agency has set up a schedule for filing claims online, And so based on your last name, you would file, if you're A through L, you would file Monday and Wednesday. And if you're M through Z, you would file Tuesday and Thursday. And if you missed your day, you could call on Friday. And that's the efforts to maybe have a little bit more control to that 1-866 number. In addition, there's also a chat feature on the website. So if you're having a difficult time getting through by telephone, you may want to try the chat feature on the michigan.gov/UIA website.
Great. Thank you very much. Folks, we appreciate you joining our call this afternoon. There's many of you on here, and we have many questions. Just to let you know, if we're not able to get to your question by the end of the call, you'll be able to leave a voicemail right at the very end of the call, and we can return your message and get you the answer that you're looking for. So please hang on there. And if you do have a question, please press 0 on your keypad. Press 0. We're going to get to as we can. Our next question is from Diana in Broomfield Hills. And to speed it up, I'm going to read the question. She's an A-negative donor and wants to donate blood. Is there somewhere she can donate? Senator Bayer, can you help her answer that, please?
Sure, Diana, that's great. That is so critical right now. The Red Cross, we are really facing a critical shortage because it's harder and harder for people to volunteer, ones that regularly do it, so especially someone who's A-negative. All you have to do is go to redcross.org and you'll see where your centers are near you. Right now, you're going to have to make an appointment because there's no place to wait, right? We have to be very careful with, they're being very careful in how they manage people coming in and making sure everybody's safe. So call them and make an appointment, and thank you very much for doing that.
Thank you very much. And Kathy Forzley from the Department of Health and Human Services, how can she do that? How do we get blood?
So another option you might have too, I agree, you need to make an appointment with Red Cross. But if you have any questions about that you would like some medical information about it, please call our nurse on call between the hours of 8 in the morning till 8 in the evening, Monday through Friday, and on weekends from 9 until 5. We have a bank of nurses ready, willing, and able to answer your questions, and the number is 800-848-5533.
Thank you very much. Would you repeat that number one more time?
Sure. 800-848-5533.
Thank you. Up next is a question from Sharon in Oxford. Sharon has a question about health insurance. She said, will the people who have been laid off lose their health insurance if they work for a small company? Kathy, Department of Health and Human Services, can you help us with that?
There are many potential solutions to that. And once again, I hate to push someone to the same number again, but our nurse on call is very skilled with not only answering health questions, but they are very up to date on health insurance information, and if they can't answer the question for you, they will get the answer or direct you to the right place.
Thank you very much. And Jennifer Llewellyn from the Department of Workforce Services, can you shed some light as well?
Absolutely. I'd encourage you to speak with your employer. We're seeing many employers that are retaining health insurance benefits for their workers. If health insurance is not available through the employer any longer, you may be offered COBRA benefits, or as Kathy recommended, connect with the nurse on call. They're an experienced group of talented staff that have a lot of knowledge around options related to healthcare benefits and how to access those in your community.
Thank you very much. Folks, we're grateful that you're still on the call with us. We'll keep going through your questions. We have a question coming up from Kim in Ferndale, and let me just get that up here for us. Actually, Kim from Ferndale is asking how elections will be handled. And can our panel address that, please?
Hi, this is Senator Bayer. So the governor is working hard and encouraging the primary to continue to go forward as scheduled and encouraging more people to vote by mail. But we do still have to have at least one place to vote in every location for people that didn't get the message, don't remember how, for whatever reason, don't want to vote by mail. But that is going to be the push to try to get people to vote from home and to continue on with our scheduled elections as they are scheduled. Hopefully that was the answer to the question.
I'd like to add to that. It is, I noticed that Kim is the president of the Oakland Macomb National Organization for Women, and today is Equal Pay Day. 82 cents on the dollar. It took until today for all of us to get paid, except for those of us in the legislature. We do get equal pay with our male colleagues as long as we're in the same party. But I do want to say also that for the May 5th elections, because there were supposed to be around 100 elections in May, local millages, school board, the Secretary of State has been working, their offices have been working with all the different municipalities and townships that had these, or school boards that are having these elections, and they've whittled it down to almost, I think the last I heard was around 50, and they have sent out absentee ballots or ability to vote from home for everyone. So they are on track to have the May election. And I think that for the August primary, whatever measures need to be taken, we want to ensure democracy. And it's really amazing how everybody is working together, pulling together, whether it's between the two chambers, with the governor, with the AG and the Secretary of State, and how all of us are like trying to come together to figure out how to make everything work in spite of the challenges that we're facing. And so we will, whatever is out there, if you have questions, definitely email the COVID resource line if you have questions. Also visit the website. Our staff have been great. I'm sure that Brenda and Representative Carter and Senator Bayer would agree that we've gone through so much training on all the new information, and our staff has gone through so much training, and it's just, so we are here to answer questions and direct you to the proper resources. And we really appreciate people who are working in government who are helping people get the resources they need.
Thank you very much for that response.
Brenda Carter, I'd like to comment on that briefly. Representative Kuppa is absolutely correct. We get daily notices from the NDHHS, the Secretary of State, the AG's office, and of course from our own governor. So if we can't answer your question now, we will definitely get your question to the correct resources for an expeditious return. So just wanted to comment on that briefly.
Thank you so much. Our next question comes from Laura in Lake Orion. This is a question that many folks have had. Her daughter works at a grocery store. What protection can they mandate for these workers? Kathy from the Director of Health and Human Services in Oakland County, can you take a stab at that question, please?
I sure will. So that's another order that we have put out for these essential services that are continuing to operate, and we have asked that they take steps to ensure social distancing is occurring in their stores, and also to ask them to look at what is the capacity that they have in their store while people are shopping, so that they can ensure social distancing both for the customers but also for the employees. So we're asking them to take a look at that and provide even social distancing markers behind checkout so that everyone's not crowding the checkout and not social distancing. And we're also noticing there are a number of stores that are putting up barriers for people at the checkouts that have people coming along and putting all their goods on the belt and then paying for their goods. They're putting plexiglass around where the checkout person is working to ensure there's adequate distance to the customer, and even a barrier between where the customer comes along closely to that checkout person. So we're seeing some really good things happening there. And we're actually working on a kudos page on our website so that people can post pictures of things where they see it working well to kind of spread these great ideas across to other retailers or other grocery stores and markets that continue to be open so that we're all safe, including the employees that are working so hard to be able to provide us food and things that we need during this period.
Thank you so much for that. Would our elected officials like to comment on that as well? Senator Bayer?
Yeah, thanks a lot. And Laura, thank your daughter for us. I just got to say, every time, when I talk to people that are out there working, when you see people in the grocery store or you see people doing, service in the community where all the time the people that are continuing to work, even though they are putting themselves at risk, and they're there and they're being of service and really just making it possible for the rest of us to get by. I can't even begin to say how much we all appreciate that and how important that is. So kudos to your daughter and kudos to everybody else that is out there working and keeping us fed. How about you,
Thanks,
Representative Kuppa?
I totally, every time I think about my paid sick leave, I think about all those workers in essential workers that are not getting paid leave. And I think there was a stick out today over the fact that in New York, in the Amazon facility, because the workers there don't get paid sick leave. And I feel now more than ever, we really need to address the issue of health care, for more equitable systems of health care and paid sick leave. The pandemic is really showing us where our weaknesses are, and these are definitely weaknesses, and we really need to protect these workers who are getting maybe $15 an hour, sometimes less. I know that our late colleague, Representative Isaac Robinson, on the 16th, he and Brenda were at a press conference 15 days ago talking about tip workers and how they don't get sick leave. And we know how important people are, like your daughter, Laura, and we really appreciate what they're doing, putting themselves out on the front line. And we will work harder when we're back in the legislature to make sure that we provide the kind of care and the kind of equitable employment opportunities, including sick leave and protecting pre-existing conditions and things like that. I understand now more than ever why government is important, and good legislation and good legislators are important to help people like her and all of them who are providing essential services for all of us and putting their lives on the front line along with the healthcare professionals. Thank you.
I'd like to comment on that as well. I recently went to a local grocery store. The stay-at-home prohibits everything except going to get groceries or getting your medication. But I was able to get out to a local grocery store, and I witnessed our workers front line there, and I don't know if they are experiencing the same shortage with PPE or not, but we talk about making sure that when we bring our groceries home or we make sure it's properly disinfected, or our mail, we make sure we set it out for 3 days. But these workers, these cashiers, these people who are on the front line of these grocery stores are constantly exposed to whatever person come into the grocery store and whatever condition they may be in. So this is something that, as Padma said, we take very seriously, and Senator Bayer outlined some very explicit details on how we should handle things. But as we see our frontline workers, whether they be grocery store attendants, mailmen, our police officers, or anybody that's out there that don't have the luxury of staying at home, we should send a special thanks to them.
Thank you very much. Our next question is from Justin. Justin has a question about schools, and he's wondering what the tentative decision is about when they will go back. Will homeschool work count towards the school year? Senator Bayer,
thanks a lot.
Respond?
Yep, thank you very much, and thanks for that call, Justin. There's probably, I know there's always a lot of questions about schools and what's happening there. And I think we will hear something official about that very soon. There's a lot of details to work on when we talk about making changes in the school year, the school system. So I know that work is going on right now. I also have heard our governor talk about, the care that we're taking. So knowing where we are in the curve with this virus, we haven't reached the peak. So it is still getting worse as in numbers of cases, and we know people are sick for quite a while. And I mean, just looking at the time of it, it's going to be difficult to get back to school this year. That should not preclude anyone from continuing to do things to educate kids. Our government, as our governor has told us, will make sure that nobody's going to be held back or punished in any way because of this. This is not the fault of any kid. And so we'll make sure that we take care of our kids, and everybody will come back to school in a way that is on the same page and knowing where we are starting from going forward. In the short term, there's a lot of things that families can do to help their kids keep moving forward, and schools, and there's no reason to stop doing what we're doing. I know a lot of teachers are out there doing things already. They're online, they're sending emails, they're sending packages home to students. So we'll keep that. We'll want to keep that going on as much as possible so our kids get every advantage that they can. And then we'll continue to work to get the school system up again and ready when we can. It's just going to be a while.
Our next question is Denise in Pontiac is wondering, how can someone get a test when they have symptoms? Kathy, can you respond to that, please?
The best thing you can do is call your physician. Your physician can help guide you through this process. As you know, testing has been pretty challenging and has primarily been reserved for those most sick, trying to determine if they need hospitalization. But as more laboratories and hospital laboratories come online to provide testing opportunities, I think you'll see things opening up, but your doctor is your first opportunity to help guide you through that process. Also, our nurse on call can assist with that as well at 1-800-848-5533. And one more thing I'd like to say is there's some new technologies that are opening up now, and I believe in fairly short order we'll start to see some new forms of testing become available to us in the very near future, which will also help increasing our medical providers' ability to provide testing. So just talk to your doctor first or our nurse on call to get the help you need.
Thank you. And we are unfortunately at the end of our allotted time for this evening. We appreciate you all being on here. We will turn the rest of the call over to our elected officials to give some closing remarks. First, Senator Rosemary Bayer, and then Representative Brenda Carter, and then Representative Padma Kuppa.
Thank you so much, and thanks everybody again for coming and joining us today. We will do everything to get all your questions answered that we didn't get to today, but we appreciate all your action with us. And I want to make sure that you all know that in Oakland County, in addition to Kathy's information on the nurse hotline, there is also a general hotline that you can call with any other questions, 248-858-1000. We have we have worked very hard to keep information available, resources available on our website, and it's organized in a way that's easy to manage. If you go to senatorbayer.com and go to resources under COVID-19, you'll see a nicely organized, easy to follow list of places to go. And our office number is 517-373-2417, and we're still working as hard as we can every day for you guys. Thanks a lot.
Okay. Thank you once again, everybody, for joining this wonderful Tele-Townhall is great. The questions that came out sparked a lot of energy in my office. I'm available. My office is available for you to answer any questions that you may have. My website is brendajcarter.com. I have specific information about the COVID virus under the page COVID-19. I encourage everyone to go to michigan.gov/coronavirus. That's michigan.gov/coronavirus for the latest up-to-date information from the state of Michigan. I encourage everyone out there to continue to practice staying at safe practices with your hands, washing your hands, making sure if you have symptoms to contact your primary care physician. If you do not have one, you can contact the Oakland County Health Department. And most importantly, during this time, just stay home, stay safe, and save lives. Now for my colleague, Padma.
Thank you, Brenda. This has been a really good town hall, and really appreciate everyone joining us. Please leave your messages. We will get back to you. My number is 517-373-1783. We do get our messages if you leave us a voicemail. In addition, you can email us, padmakuppa@house.mi.gov. Please take 10 minutes to fill out your census. I know that you spent an hour with us. Take another 10 minutes after you're done and fill out your census if you haven't filled it out yet. Those tax dollars need to come back to our communities. And definitely stay in touch with what's going on with the COVID hotline, 888-535-6136. And thank you very much for joining us today.
Hey, I'd like to just comment once on that before I go, Ivan, if you don't mind. It's so very important that we take time to fill out our census. The workers that usually come to our door and assist us with this is not going to be out until the middle of May, if then. If we go online, it is a very easy process. I did it for our home, and everything you need is right there. It's so very important that we fill out our census so we can maintain the services that we need in our state. The website is 2020census.gov, 2020census.gov. Thank you for that.
Thank you, Representative. To bring it to the finish line, we'll turn it back to Tom, the State Director for the State Innovation Exchange for Michigan. Folks, just want to remind you also to stay on the line if you have a question. And at the very end of the call, in just a second here, you'll be able to press 0 and leave a voicemail. Tom, over to you.
Thank you so much. I'd like to thank Senator Bayer, State Representatives Kuppa and Carter, and Oakland County officials Kathy Forzley, Director of Health and Human Services, and Jennifer Llewellyn, Manager for Workforce Development and Director of Oakland County Michigan Works Agency, for joining our conversation tonight. Thank you to everyone listening in and asking great questions. To stay engaged, please check out www.stateinnovation.org or follow us on Facebook or Twitter. And please stay home, stay safe, take care of yourselves, your neighbors, and have a great night.